Hello, and welcome to GAPNA Chat, an official podcast of the Gerontological Advanced Practice Nurses Association. GAPNA Chat provides interviews and discussions with GAPNA leaders and members of the gerontological healthcare community, and will focus on advocacy, policy, education, professional development, research, and clinical care for older adults. In this episode, Dr. Cassandra Vonnes, a gerontological nurse practitioner and member of the GAPNA Communication Team, talks with Ms. Michelle Wade, the lead hospitalist at Gifford Medical Center in rural Randolph, Vermont, and a member of the Gerontological Advanced Practice Nurses Association. The Improving Care and Access to Nurses Bipartisan Legislation, also known as the ICAN Act, or HR8812, was introduced in Congress on September 13, 2022, by Representative Lucille Roybal-Allard and Representative Dave Joyce. This bill seeks to remove barriers to practice under the Medicare and Medicaid programs by increasing access to healthcare services provided by advanced practice registered nurses. Ms. Wade takes a deep dive into the ICAN Act and discusses the implications this bill has for advanced practice nurse practitioners and patients covered by Medicare and Medicaid. We are pleased to present Dr. Vonnes' interview with Ms. Michelle Wade. This interview was conducted on September 19, 2022.
So welcome, everyone. This is Dr. Cassandra Vonnes, and we are starting our GAPNA Chat. We're still in our second series, and today we have with us Michelle Wade. She is a dual certified adult gerontological, acute, and primary care nurse practitioner. She is the immediate past president of the Vermont Nurse Practitioners Association and is active on the conference and policy committees, as well as being Vermont's state liaison to the American Association of Nurse Practitioners. Michelle is a fellow of the AANP. In 2018, she was awarded the AANP Nurse Practitioner State Award for Clinical Excellence in Vermont. She led a project to reduce the rate of readmissions to hospitals from local nursing homes. Michelle is currently the lead hospitalist at Gifford Medical Center in rural Randolph, Vermont. In this role, she cares for a diverse population in a small town and works to teach patients about their illnesses as well as to improve their overall health. Michelle serves as a member of GAPNA's Health Affairs Committee. Thank you, Michelle, for joining us today for this conversation. So at this point in your career, would you have anything to tell the 18-year-old Michelle?
Well, first, thank you for having me. And, I think I would, to be honest. And I think it would be to start in a hands-on role, which I sort of did as a licensed nursing assistant or certified nursing assistant, depending on where you live, what your state calls it, or even perhaps in a dietary role, but somewhere where you get an integral look at what the profession is about from the ground up. Because I think it is so important that we understand this amazing profession from every aspect, and also to understand that if you decide this is where you want to go, meaning nursing, that you have thousands of options to use this education in hundreds of different ways. And it could be anywhere from bedside care to office setting to in the community, home health, leadership, education. As you decide to change up your career after some experience, it might be quality assurance. And opportunities are endless once you have your nursing education. But make sure with a hands-on start that it is what you think it really is, I guess, is my advice.
That's something that as nursing faculty, I think we see that missing in a lot of our nursing students. So thank you for that. So originally, we had planned to talk about the 2022 CMS collaboration guidelines, but something major happened in Washington, D.C. last week. The Improving Care and Access to Nurses, or ICAN HR8812, a bipartisan legislation was introduced last week in Congress by Representative Lucille Roybal-Allard and Representative David Joyce from Ohio. And it was released in a press conference on September the 13th, 2022. More than 200,000 APRNs are treating Medicare patients, and about 40% of Medicare beneficiaries receive care from APRNs. What does this bill mean for the advanced practice registered nurses?
This bill is super, super exciting because we, across the continuum of advanced practice nurses, have been trying to get parts of this bill passed for many, many years, and it brings everything into one place. And what this bill does is it aims to remove administrative and practice barriers by authorizing all advanced practice registered nurses to do the things that we know we need to do for our patients, specifically things like order and supervise cardiac and pulmonary rehabilitation, order diabetic shoes or footwear for our patients, to be able to refer our patients for medical nutrition therapy, and to be able to certify our patients for terminal illness for hospice eligibility, and also equally important, all of the mandatory examinations in skilled nursing facilities. Now, I just said a lot in a little bit right there, and I'm going to talk more about them, I think, as we go on here. But basically, if this was passed, the ICAN Act, or HR8812, it would allow advanced practice registered nurses patients to be fully included in the beneficiary attribution process for the Medicare Shared Savings Program, as well as all of these patients could get all of the above services I just talked about from their primary healthcare provider and not have to go see a different provider just to get the care that we know they need.
That is way overdue. Things that, very intuitive to us that we should be able to order for our patients have needed a physician signature. So APRNs practice very differently from state to state. Does this federal legislation address full practice authority across the 50 states?
That's a really great question. And it's really important that we delineate what it does and doesn't do. The legislation does not provide full practice authority in all 50 states. Individual states govern these guidelines. But what it will do is it will reduce a number of federal barriers that impede access to care for millions who receive health care through Medicare and Medicaid. Many of the patients that we have today receive their insurance through Medicare and Medicaid. And because of that, we can't give them the care they need. All the things that I talked about just a moment ago, specifically diabetic footwear, ordering cardiac rehab, medical nutrition therapy, ability to certify for hospice. These are all things that are within our educated scope of practice, but have legal barriers. And the legislation is consistent with recommendations from numerous healthcare stakeholders, including the National Academy of Medicine in its Future Nursing 2020-2030 Charting a Path to Achieve Health Equity report. They were very, very clear that it recommends that all relevant state and federal and private organizations enable nurses to practice to the full extent of their education and training by removing practice barriers that prevent them from more fully addressing social needs and social determinants of health and improving healthcare access, quality, and value.
Well, that's a start, isn't it, in the right direction? I think a lot of us have had our emails blow up with professional organizations, talking about this. And clearly, this legislation is receiving strong support from our national nursing leadership in several nursing organizations. Can you share a little bit of what nursing leadership is saying in regard to this legislation?
I would love to. I think it's really important to understand that multiple nursing organizations came together for this piece of legislation. And the press conference that was on the green at the White House last week at that conference, Dr. April Capu from the American Association of Nurse Practitioners stated, the health of Medicare and Medicaid beneficiaries depends on timely access to high-quality health care. And she went on to say it's critically important that healthcare policies reflect who is providing the care in our communities and that our healthcare system is effective and efficient. The ICAN Act would move healthcare delivery forward for these patients, providers, and our nation. In her statement there alone, it summarizes everything that we just talked about and the fact that we're providing the care, but we need to be the provider of record for that care. And that's what this will do. And it will also allow us to provide the care that we know our patients need. As a nurse practitioner with my boots on the ground, and with a strong passion for advocacy, I can share that this will directly improve my patients' care. And it will do that because I will have the ability to order and supervise cardiac and pulmonary rehabilitation. This service improves quality of life for my patients, and it can also prevent rehospitalizations. The ability for me to order diabetic shoes. I can tell you briefly about a patient that I had several years ago that was a diabetic and did not have therapeutic shoes. This patient unfortunately could not feel that he had a pebble in his shoe. And ultimately, he ended up with a sore on the bottom of his foot that he didn't know was there for several days because with his diabetic polyneuropathy, he couldn't feel the bottom of his foot. This went on to lead to an infected wound that required hospitalization, admission to a long-term care facility, which is where I met this patient. He was in the long-term care facility for rehab and IV antibiotics for over 3 months. This wound, he became septic. He ended up ultimately requiring amputation of his lower extremity because he could not get access to the shoes that he needed early on that could have potentially prevented this. All because his nurse practitioner referred him to a podiatrist so he could get it, but the wait was greater than 4 months to get into a podiatrist.
Just one example about delay in care. So this impacts nurse practitioners, but also other APRNs. And
Exactly.
You wanted to say how it affects them also.
I do, exactly. Not only is it the APRNs, which is a broad encompassing scope for all advanced practice registered nurses, but there is also the American Association of Nurse Anesthesiology, and Dr. Angela Munn was present, and her statement is very accurate, allowing certified registered nurse anesthetists and other APRNs to practice to the full scope of their training and licensure will ensure that patients are put first, that competition drives down costs through the removal of artificial and unnecessary barriers, and that providers of all types are able to better serve their patients. And my example of the diabetic patient speaks just to the cost and unnecessary barriers right there. If these barriers to care were waived during the pandemic, which they were, and nurse practitioners across the spectrum were able to provide timely access to care for their patients, currently, there's no evidence that proves that these provisions should end. These provisions need to stay in place, and that's what this bill is about.
When we look at advocacy, is there a deadline around when this will be coming for a vote? It will be, within this session by the end of the year, or what kind of time frame are we talking about?
That's a great question. So we all know that this legislative session is coming to an end quite quickly. We are really hoping that it will move in this legislative session. So it's going to be a lot of grassroots advocacy that is going to be needed, and it's going to need to be all hands on deck. And part of the all hands on deck piece of this is there's an advocacy center that is sponsored by AANP, and I'm sure that GAPNA probably has a link to it, but it's advocacy/advocacy center on the AANP website. Any advanced practice nurse, whether you are a certified nurse midwife, whether you are a nurse anesthetist, whether you are a primary care, acute care, it does not matter. Anybody, and you do not even need to be a nurse, you could be a patient. anybody can use this advocacy center. It's currently up and running, and it's a couple clicks. You fill in your name, your address. It will automatically populate the correct legislator representative that this needs to go to. You can add personalization to the letter if you so choose and send it off with a couple clicks.
That is great. So the letter is crafted for us, right? And it is everything that we need to say. At our GAPNA conference last week, Dr. Donna Hamby, the chair of your Health Affairs Committee, presented at a plenary session about the role and responsibility of the APRN for effective advocacy. So you have shared with us some ways that we can be involved in moving HR8812. Thank you for that. Appreciate that. We did hear, it was a little teaser, that your Health Affairs Committee is putting together an advocacy toolkit for GAPNA members. Do you know anything about when it's going to be ready for publication?
Unfortunately, I don't have a set date. I have also heard the teaser. I do know, and I did check just before this broadcast, that the letter portion of it is up and running, and I was able to have my husband do it as a non-member. So I know that it's up and running and working, so everyone can utilize that.
Just another quick question about the congressional session. Are these two sponsors up for re-election? So after 2023, if this does not get to a vote, does it need to be represented in legislation, or will it just be carried forward?
Unfortunately, it's the time of year where we are in the Congress that it will have to be represented, irregardless of whether these folks are continuing on or not. So we are really in a time crunch that we really do want to see this move this year, this session. So our legislators from across the country have come back to Washington just in the last week to 10 days. They're all back, or most of them are back there now. And so now is the time to reach out to them. If you have local offices for your legislator in Washington and you have a contact with your local office, now is the time to make that contact as well.
That is great news. And GAPNA wants to hear if you have been providing any outreach. Please share in the GAPNA exchange. We will again provide the link at the end of this podcast for the AANP advocacy website that has made it very easy for us. There is no reason why we can't, before the end of September, in response to this legislation being presented, show our legislators that we really want them to do what's best for the patients by eliminating these barriers for us. So wonderful. Would you have anything else that you would like to share, Michelle, before we go?
I think one area of this bill that I didn't chat about yet that is very important is that this will also create so that nurse practitioners can perform all mandatory examinations in skilled nursing facilities. So patients will be able to be admitted under a nurse practitioner's name if they are receiving Medicare services, or if they're under certain private insurers that are currently following Medicare guidelines. It will also make it so that nurse practitioners can do the certification, recertification on the 30, 60, and 90-day windows, as opposed to having an unknown MD or DO provider come in and meet a patient at their most vulnerable time. Hospice eligibility is also within this bill, and it's going to amend the titles 18 and Title 19 of the Social Security Act and Bipartisan Budget Act of 2018, which allows nurse practitioners in this case to perform all of these evaluations and certifications for their patients.
And in the long run, patients will get the referrals, the examinations, the treatment orders in a timely way, as opposed to having to wait. And
Absolutely.
It will save Medicare money, because we're oftentimes doing it, and just waiting for that medical authorization. So this is wonderful, Michelle. Thank you so much for joining us today and sharing your time and expertise. This is Dr. Cassandra Vonnes for GAPNA Chat, thanking all of you for being part of this conversation. Until next time, be kind to yourself and one another.
GAPNA Chat is owned and produced by the Gerontological Advanced Practice Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. Ms. Michelle Wade is a dual-certified adult gerontological acute and primary care nurse practitioner. She is the immediate past president of the Vermont Nurse Practitioners Association and is active on the conference and policy committees, as well as being Vermont's state liaison to the American Association of Nurse Practitioners. Ms. Wade is currently the lead hospitalist at Gifford Medical Center in rural Randolph, Vermont, and serves as a member of GAPNA's Health Affairs Committee. Dr. Cassandra Vonnes is the Nurses Improving Care for Health System Elders Niche Coordinator, Geriatric Oncology, at the Moffitt Cancer Center in Tampa, Florida. She is a member of the Gerontological Advanced Practice Nurses Association Communication Team and is a host of the GAPNA Chat podcast series. For archived episodes of GAPNA Chat and to learn more about the Gerontological Advanced Practice Nurses Association, visit gapna.org. You can also subscribe to GAPNA Chat everywhere podcasts are found.